If your son or daughter hasn't gone through a growth spurt, but tears the ACL in his or her knee, do they need to have surgery right now, or should it wait until they're older? I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist. I provide education and commentary on all sorts of sports and exercise injuries and injury treatments and injury prevention for athletes and active people so that you can stay healthy and perform your best. We've talked recently about ACL injuries and why they're a big deal and why so many people need to have surgery. One of the controversies over the last 10 or 20 years with these injuries really revolves around young kids that haven't gone through their growth spurt. They still have open growth plates around their knee. And the concern with these surgeries, at least the way they're done in adults, where you're drilling tunnels in the bone to pass the graft up into the knee, as I've described in another video, is that you would potentially drill through the growth plates, drill a small hole through each of the growth plates, one in the tibia, one in the femur, and that could basically cause one leg to grow longer than the other, or have an angular deformity to the knee that you don't have on the opposite side. So historically, what we used to do is, if a 12-year-old or 10-year-old tore his or her ACL, we would say, hey, maybe we'll put you in a brace. We're going to completely shut you down from sports. And when you finish going through your growth spurt, 16 years old or whatever it is, depending on that child, we would do ACL surgery then when they're essentially adults. And we did that for a long time. There was a problem with that historically, and then we'll talk about some of the current thinking. But imagine trying, if you have kids, and maybe if you're watching this, you do have a young kid with an ACL tear, imagine trying to keep them out of sports. Even if somehow you could successfully keep them out of baseball or basketball or soccer or football or whatever it is, it's really hard to keep them from being physically active, from playing with their friends after school, or at recess during school, or in PE class at school. You can't just have them sit there. It's just really hard to shut kids down. Even in a brace, that typically doesn't go very well. So if they continue to do those activities, the knee very likely may give way and they may do more harm to their knee. Now, you may wonder what that risk is. Well, we've studied that and have gotten data on that in recent years. There have been a number of studies within the last few years that have shown a significantly higher rate of damage either to the meniscus, the C-shaped shock absorber within the knee, or to the articular cartilage, the cartilage lining within the bone, a significantly higher incidence of damage either to the meniscus or to the articular cartilage with ACL injuries that basically were treated without surgery even within the first year in young kids compared to the kids that had surgery. And because some of that damage, especially cartilage damage or some meniscus tears, can't be made normal again, basically turned back to where there was no damage as before, again, because a lot of times you have to trim out meniscus tears, that can lead to problems down the road. So we like to prevent cartilage damage, prevent meniscus damage before it ever occurs. So the trend now is getting more and more to doing these surgeries earlier, pretty much, in the weeks after a young kid tears the ACL. Yes, the grafts can be a little different. The way the tunnels are drilled can be a little different to minimize the risk of drilling through the tunnels, even though some people debate about how high that risk is when you use certain grafts, that it may not be that much higher. But having said that, the trend is to getting to doing these. Orthopedic surgeons and sports medicine surgeons do these earlier and earlier after a young kid suffers an ACL tear, well before they go through their growth spurt. Okay, have you suffered an ACL injury, or your kids have suffered, I should say, an ACL injury before they went through a growth spurt? What did your doctor recommend? What did you ultimately decide to do? I would love to hear your experience, and I know people all around the world would as well. So below this video, share that experience. I'd love to read it, and I know it would provide value to people dealing with this same problem themselves. If you know somebody who has a child dealing with an ACL injury, please share this video with them. I want to help as many people as possible. That's why I create these videos. And if you like videos like this and you want more information on sports and exercise, injuries and surgeries, subscribe to my YouTube channel. There's a button in the upper right corner of this page. Click subscribe. I record a couple of these videos every single week and they'll get delivered directly to you. Thank you so much for watching. I hope this video was helpful and I look forward to seeing you right here next time.